our first presenter for tonight. He is a licensed caregiver, social worker, a psychiatric social worker in Japan. He is also passionate to share about dementia care knowledge to the world. That's why he's in Manila, Philippines, to teach the Japanese style of caregiving to Filipino care workers. He is also one of the passers of Dementia Care Expert Exam 1 last December 2020 in Manila, Philippines. To discuss his topic, Dementia Design Care, let's welcome Mr. Junichi Jack Fukui.
Thank you. Good evening, everybody. Good evening from India and Philippines, Malaysia, and Japan. Thank you. So during my lecture, I will ask some of you about my question. So please be ready and then please listen carefully. Okay. Let me share my slide. Hold on a second, please. Okay, everybody can see? That's okay. I thank you. So my topics today is dementia design care. Let me introduce myself. My name is Junichi Fukui, but you can call me Jack. I'm a certified care worker and a social worker and a mental health social worker, and also the dementia care expert and the food lifestyle advisor. This is a picture when I worked in the care home for the elderly in the United States. I worked there as a caregiver. Okay, the patients are Japanese American, and most of them have dementia. And some of them are bedridden. They were about 10 patients living together. Every weekend, the patient family visited our care home. This is a picture of celebrating the one of the patient birthday. Okay, then 10 years ago, I came to the Philippines. Now I'm living in the Philippine Manila. Okay, this is a picture of the Filipino caregiver and the nurse. They all want to work in Japan, but they have to pass the national exam so that I support them to how to pass the examination. Then some of them pass the examination. Then now they are all working in Japan as a caregiver. Okay. Then aside from the caregiving field, I occasionally provide the lecture of nutrition and diet. And I'm a theater therapist. You know that if you have a muscular pain or stiffness of the muscle, I can treat and relieve your stress. Apart from my profession and occupation, my hobby is boxing. I used to be the professional boxer in Japan. And of course, my ideal person is Manny Pacquiao. Okay, so please look at this slide. You know, I was a little bit chubby when I lived in the United States because the amount of the meal, you know, really big. Then I don't want to waste the food so that I naturally gain the weight. But when I came to the Philippines, unfortunately, I was poor and couldn't afford to buy the, enough food so that I naturally reduced my weight. But it's just kidding. So I just studied nutrition and then proper diet to successfully reduce my weight. But you know, it's a little bit too skinny so that I trained my body and strengthened my muscle so that I believe now my body is very healthy and sexy. Okay. So I know that some of you are interested in the nutrition and the healthy diet. So I'm scheduled to give a Japanese way of healthy aging and nutrition lecture. So please look forward to it. Okay, the today's topic is the dementia design care. Dementia design care is a makeup word which are combined with dementia care and design thinking. Okay. Why I applied design thinking on dementia care? Because dementia care and design thinking can be, overlapped in important point. And with the approach of design thinking, we can develop the sense of dementia care. The key to design thinking is out of the box. What does it mean thinking out of the box? Okay, we have our own way of thinking. We always decide or choose within our particular framework. It seems like thinking inside the box. Inside the box. If we stick to our framework, we can't think in creative or innovative. If you want to be creative or innovative, you should think out of the box, out of your framework. Okay. Design thinking help you to think out of the box. Nowadays, changes in time are so fast. It is getting difficult to find the solution inside our framework. But most of the time, solution is out of your framework, so that we should think out of the box. Okay. So at the beginning, what is the design thinking? I want to explain with this way. What is the difference between the artist and the designer? Both professions are said to be a creator, and they are making something new in creative way. Okay, then what is the difference? What is the difference? Does anyone answer this question? Anybody? Okay, well, it's okay. So I just explain. So for the artist, when artists create a work of art, artist is talking with themselves, talking with himself. The idea will come from his imagination or inspiration. Once he come up with the idea, artists try to materialize it, like a painting or pottery and statue. Okay, artist can turn his own idea to his work. An artist create what he want. Okay, what he want. On the other hand, designer create what the client want. What the client want. Okay, so designer have to follow the idea of the client or target user. That's why before starting to create a work, designer will research a target user. The designer put on a lot of information about the target user into her head. Okay. Then we can say that the designer is a person who visualizes what the user or target user really want or need. In other words, designer solves the problem of the target user in creative and innovative way. Okay, what a designer designed can be furniture and clothes and concept and service, etc. Okay, this is a comparison. An artist create what he want, but designer can solve the problem of a target user. That's why the designer create what the client want. Okay, if the client doesn't have any problem, the designer has nothing to do, because the designer needs someone, and the design is to solve user's problem. Okay. Design thinking is problem-solving approach. Now you understand that the designer apply on their work, but designer's work process can be used for other fields, so that some of the world-leading company brands such as Apple or Google or Samsung and GE have rapidly adapted the design thinking approach to their service or product. How about our field? Our field is the nursing field, right? So let's try to use design thinking approach in nursing field. Okay. So first, we should research the background of the target user. Okay, Mr. A. Let's say that Mr. A has Alzheimer type of dementia. He is weak in the legs and he lives in the nursing home. He has urinary incontinence and he loves drinking. He loves drinking. I also love drinking. Okay. Then his wife passed away and has no children. This is the background of Mr. A. Okay. Then Mr. A asked designer, supposing you are designer, he's designer, okay? Mr. A said, I miss my pet, but the nursing home doesn't allow me to bring my pet. That is his problem. Then designer tried to think how to solve Mr. A's problem. Of course, since he lives in the nursing home, he is not allowed to have a pet. How can you solve his problem? Let's think out of the box. Okay? Does anyone have idea? So one of the solution or like this. Okay? This is the one of the idea. Okay, robot pet. Actually, there are many types of the robot pet in Japan. You know, robot pet have facial expression, and some of the robot pet has their personality like a real animal. Then the robot pet can communicate with the patient. This is the robot sphere. Okay, robot sphere. Instead of food, the robot sphere is feeding electricity. Then the old lady taking care of the robot pet. Okay, this is the one of the idea, thinking out of the box. Okay, the next. So Mr. A asked you, I want to have a drink at the bar, but can't stand for long. Do you remember? Because he is weak in the legs. He can't stand for long. But you know, the bar counter is high, right? So how do you solve his problem? How do you solve his problem? This is one of the solution. Standing wheelchair. Okay, this wheelchair can be transformed from the ordinary sitting wheelchair into the standing one. So when Mr. A drinks at the bar counter, he can stand with this wheelchair. But when he is tired, he transforms the wheelchair into the sitting position and rest on the wheelchair. Okay. Okay, the next is this. From the caregiver of Mr. A. Caregiver say, Mr. A always pee inside his pants and he can't hold it for long. You know, he has an incontinence of urine, right? He sometimes cannot hold the pee. So that make wet and dirty on his pants. The caregiver asks you to solve Mr. A's problem. So what do you think? My answer is this. This one. This is a sensory appliance to avoid incontinence of urine. Have you seen this before?
No.
So, okay, this is a, this appliances is to connect with the smartphone to let you know when the patient want to pee. Actually, if you bring the patient before he pee, he wouldn't make the wet and the dirty on his pants, right? Both the patient and the caregiver are very happy. Okay, so now you understand. Design thinking is a problem-solving approach. It is not only for designer, but also for all great innovators in various fields. Then I discovered it is also effective to apply it on nursing field, especially for the dementia care, because people in the nursing field need to solve the patient problem in the patient daily living, right? Each patient have different disease and symptom and different lifestyle and different sense of value. Therefore, the problem-solving approach should be creative and innovative. So we can't solve their problem with uniform way or only one approach. We need to design thinking approach based on the patient. Okay. One of the important concepts of design thinking is human-centered design. Human-centered design is a creative approach to problem solving. It's a process that starts with the people you are designing for and end with new solutions that are tailor-made to suit their needs. Human-centered design is all about building a deep empathy with the people you are designing for. Then in the design thinking, we need to use both right and left brain. We usually use left brain to think logically and speak, write, read, doing related to language. Actually, the people in medical fields, such as a doctor or nurse, tend to use left brain because they should think logically. On the other hand, the right brain works when you listen to the music or think the picture, image, and create something. In order to make both brain function, it is effective to visualize what you think, because when you see something, your right brain functions. And collaborate with different fields of profession to think out of the box. So that I will use the mirror later in this lecture. We should think out of the box by visualizing our idea and collaborating with different people. The mirror is like an online whiteboard. Then this is a very effective online collaboration tool. In the past lesson, I used the mirror. The participants are Japanese and Filipino. Japanese and Filipino have different way of thinking, right? Then we can see what other nationality tend to think. Like this. Visualize. Then when I collaborate with other profession, mirror is also very effective. That time I was working with the person from the consulting firm, government employee, person from the international corporation, and car industry. They have different field of profession. As I told you, people have their own way of thinking and try to choose and decide inside their framework. That's why in order to think out of the box, it is helpful to collaborate with other professions. Mirror can visualize what other professions think. And sometimes I report the meeting by using mirror. Instead of the writing only, it is much easier to understand. Maybe you cannot read Japanese, but somehow you can guess what it discussed, right? Because there is a picture. So combination of dementia care and design thinking can help you to improve the sense of dementia care. That I believe. Okay, let's talk about what is dementia. Okay, dementia is a syndrome caused by variety of brain illness that cause memory disorder, which affect the ability to perform everyday activity. Dementia is chiefly defined by gradual and permanent memory loss, and it causes disability for people to lead their usual life. How it causes dementia? Okay, first of all, organic disturbance like this appears in the brain, such as amyloid Lewy body, which is the abnormal collapse of protein, or cerebral vascular disease, such as cerebral hemorrhage or cerebral infarction. dementia can affect the people differently and cause different symptoms. The type of dementia is set depending on the area of the brain that affected by the damage. Okay, and then as a result, it causes memory loss, memory disorder. Memory disorder interfere with daily life, such as disorientation or disorder and executive function disorder. Okay, that we call core symptom. Okay, core symptom. Core symptom can't be cured, cannot be cured, and there is no treatment because the brain itself has damage. Okay? Then core symptoms interfere with person's daily life and activity. Okay, number one, the BPSD. BPSD is a behavioral and psychological symptom of dementia, such as shouting or wandering, the verbal aggression or violence. And the number two is a mental disorder like illusion, hallucination, delusion, depression, apathy. And the number three is sleeping disorder, nocturnal restlessness, difficulty sleeping at night, delirium. And the number four is a physical disorder, paralysis, difficult swallowing, eating disorder, constipation. And the number five is a communication disorder like making up story, speech disorder, restlessness, resistance to caregiver. Okay, many kind of symptoms of disability appeared, starting from core symptom. And then, as I told you, core symptoms are unrecoverable, cannot be cured. There is no treatment. Okay, core symptom. But BPSD, including all of the symptoms caused by the core symptom, can be alleviated, sometimes cured completely. So I will explain how to cause the BPSD. First, the brain has damage. Okay. Then as a result, it causes the memory disorder, like memory loss or disorientation. In addition, the patient are exposed to the negative feelings such as anxiety or discomfort or distress, and inadequate environment and then inadequate care. As a result, BPSD will be apparent, like wandering, aggression, or hallucination, or delusion. Okay, this is the procedure how to cause the BPSD, like this. Then in the past, we didn't know anything about dementia, so that the BPSD were considered as problematic behavior. But now there are many scientific data, and we accumulate the knowledge and experience so that we believe that the BPSD are considered as a message from the patient with dementia. Okay, then let's go one step back. Instead of letting them have negative feeling and providing inadequate living environment or providing care, we treat with them in opposite way, like relieved from anxiety, relieved from discomfort, relieved from distress, and arranging adequate environment and providing adequate care in opposite way. Then we can help the patient alleviate BPSD. But it is difficult for patients with dementia to express their feeling and the symptoms that they are suffering from because of communication disorder. so that how we can understand how the patient feels and what kind of symptom patients are suffering. How can you listen to patient message? You know, out of the one of the important theory of dementia care is person-centered care. Treatment and the care program could be tailored to meet the individual needs of patient. Okay. Care should focus on the individual and how the patient is leading their everyday life, rather than addressing symptoms of the disease. Service should be provided by patient own choice, rather than providing service according to the judgment of the caregiver. So, the patient or individual is more important than disease. Patient is more important than caregiver. Because dementia is a small part of the patient, right? Not everything. We should focus on the patient. Like this. Because, you know, the dementia care is person-centered care to solve problem in creative and innovative way. Because each patient have different disease and different symptom, and different lifestyle and different sense of value. We can't provide uniform care service, but should be tailor-made service to suit their need. By the way, do you remember what is design thinking? Design thinking is human-centered design to solve problems in the creative and innovative way. Dementia care and design thinking can be overlapped in the important point. Both methods are based on the person and thinking out of the box. So combination of dementia care with design thinking is dementia design care. I want all of you in the nursing field and involved in the dementia care to be creative and innovative. Dementia design care help you to think out of the box to solve patient problem in creative way. That is dementia design care. Okay, so let's move on using mirror. Again, click the sticky note, choose the color, and post it. Then write your nickname. Good. I give you the 3 minutes. Let's say, like this. Providing like a care robot. Something like this. Then connect solution to problem. Like this. Right? Good. Okay. How about this? Let her listen to music or give something she can do, like to draw by a draw. Good, good. Marilyn, good. How about the delusion? Go into the patient world by go into the patient world. Good. Cindy-san, very good. And stay beside her and talk with her. Good. Miss Marilyn, very good. Illusion. これが go to カラオケ。Oh, very innovative. Very creative. Go to karaoke. Good. Nobody bother. Okay, I know that maybe most of you are first time to use a mirror, so it's awkward to using the mirror. It's okay, but I want to know a mirror, and then mirror can help you to collaborate with other profession, and also mirror can help to become more creative and innovative. Okay, it's free. So you can use or you can study how to use Miro. Okay. So I think it's the time's up. Okay, thank you very much.